In patients with sleep apnea, we often see that they have wear and or grinding patterns on their teeth. This reduces their vertical dimension, restricts the airways, and makes breathing during sleep more difficult. By addressing their vertical dimension issues, opening up their airways, it allows for more oxygen, more air to go in when they're asleep. So a lot of patients don't even realize that that's actually part of dentistry. We as dentists, we can see all these issues happening in their mouths. And a lot of dentists themselves don't even have training in looking at airway issues.